No, I've never. No, I can't explain. It was like an horror story. I can't think of it.
I don't want to upset you.
No,
I
no.
just want to capture
I remember
that.
leaking like, and I've never leaked since in 15 years.
I said, why are you crying? And she said, I wish my mum was alive. And people ask me
Why you do it?
why I do this job. Hi everyone. Today I'm very lucky to be speaking with Sandra. Sandra is going to have surgery when?
14th of August.
14th of August. Oh, not long. Exciting.
Yeah,
exciting.
very.
What we're going to talk about today is things that I think would be useful for a lot of people watching this to hear. One of the things I've heard for such a long time is people think that, there's only one or two people with the same problem and nowhere near as bad as theirs. And yet, we don't look at it as complexity. We just look at it as, well, we need to find a way to solve your problem.
Yeah.
And every single one of you is different. I've never done two cases that are identical. It's just not going to happen. So we don't have words like complicated. We just have words like different.
Yeah.
Okay, because no two are the same. It's so much more complicated than shoe sizes. So everyone's got different size shoes.
But different widths and
multiply that by 1 million, and that's the amount of variation that we've got between patients.
Yeah.
And what I really want to talk about is how long you've been in a state where you needed this, and the beginning, how it all started. So I'd like to start from there. So tell me your story of how you ended up needing this.
Well, I started like going dentist more. I was getting abscesses and one thing and another. And
Sorry, what age were you at that point?
about 40, coming up to
About
40.
40.
Yeah.
Right.
And that's when he said, the dentist at the time said he would recommend the rise of my light because then stop me having to go out so regular.
Right. And how regular are we talking about?
I do remember having toothache quite a lot at then, but it was usually down to abscesses or infections and this.
Right.
And I was going more and more, and he said they were crumbling away my teeth.
Right.
And I had a baby of 38, and he said that wouldn't have helped.
That wouldn't have helped. Right. Okay.
Because the calcium or something.
The calcium was
Yeah.
being drained. I've heard
And then
that
he-
too. Yeah.
And I just went along with everything he said. I wasn't really given much of an explanation. And then he said I wouldn't need to be under general anaesthetic. Sedation had come out then in the hospital.
Yeah.
And he pushed that a lot. So that, like, I was because I was scared of, an operation.
Yeah.
I mean, being under general
Yeah,
anaesthetic.
Of course, yes.
So the sedation thing. And then I wasn't prepared for how I felt when I went, afterwards.
Yeah.
But then I wasn't as bad at first, and then I said, I couldn't. The bottom ones never ever fitted right, and I went back a few times, different dentists, and they never did. And then, so I was constantly
denture after
taking the
denture.
one, the bottom one more so.
Yeah.
I used to take it out all the time because
Yeah.
I could never eat
So the minute
anything.
you get back in the house, they're
Well,
out.
anywhere.
Anywhere.
Yeah, and then I became an like tissue, because I
Yeah.
couldn't really even stuck through a straw with the bottom one
Yeah.
at the time because I couldn't talk at all because they just come up
Yeah.
all the time.
Yeah.
And then, so because I was taking meds all the time, I'd drop it or something broke, and then my latest dentist said, well, I didn't have a dentist then for ages, I just had none. Then never went and just started away, really.
Tell me about, after you just had the teeth out, right, and you were by yourself at home, tell me the first thoughts that went through your head when you'd realised that they had gone,
Yeah.
And it's now false teeth.
Yeah. I remember, like I said, I felt funny anyway when I first looked in the mirror.
What did you feel had gone?
I remember thinking, like, I looked like, how can I say, explain it, like, no, I can't explain. It was like an horror story. I can't think of me.
I don't want to upset you.
No,
I
no.
just want to capture
I remember
that.
looking like, and I've never looked since in 15 years. I've never ever looked in a mirror with none. Not that I never said. I've had no bottom ones phrase now because I had some in, I think, was it July? But then that tooth there broken, so they were ever fitted right again. And then I've dropped them, but said I can't have any more because I can only have one a year. You know,
Yeah.
on NHS
Yeah.
probably, and
Yeah.
then, like I say, you become an expert at
Yeah.
just,
Yeah.
you know, if I always
Yeah.
got a cold or a cough and
Yeah,
or something, you know,
Yeah.
too hard to wear with.
All of my patients have exactly the same thing in common. All of them. I can spot them so easily when I'm out and about.
Really?
I can just see.
And you think it's just
I'm
you?
just looking around and you're like, you know, it really upsets me because I just think to myself, you have forced yourself to develop things, habits
Yeah.
that were so alien to you at one time, but that's only because you are conscious of it every second of the conscious day. It sort of rules every act.
Yeah, it does. You don't realise. Yeah, it does definitely.
And it's a chronic process. So over time, it just molds people into different people, you know, and they do things that they would never have done on this side of the line.
Yeah.
And now these things are almost essential.
Yeah.
Like the whole moving the hands, covering the mouth, like the whole,
I
you
do
know,
that with my
talking
tongue,
with the head
yeah.
slightly down, all of that stuff. I think what's always bothered me is the fact that for 26 years, I'm looking at another human being
Yeah.
and I'm thinking, I don't know, it's the same thought I have in my head as a human being. You're not whole, you're not complete. Something's missing.
Definitely.
All the time, you know? I need to try and find a way to help you get back there.
Mm.
So you can just have what the rest of us have. It's just a life where you don't think about this
Can't. Yeah.
24 hours a day. And it's that bit that's always bothered me. I did all the assessments myself. I remember meeting people for the first time when they turned up to me, and it's always the same. They're anxious. They're looking at me like I'm part of the system that put them where they are.
Mm.
And to an extent, with the title, I probably am. But I'm actually the guy who's trying to reverse it. You know, I'm the guy who's trying to make it what it was, not what it is.
Yeah, definitely.
You know?
It's not just. I remember I always worked years ago, and then always on people related jobs, like different things, and then not just because of that, but I didn't work for a while. But then you become where I wouldn't go for an interview. So I did all that. Job centre send you on different courses and all this. And I'd do all them because it was behind, you know, at home and what.
Yeah.
Pass all them, but then come for the interview, think, I'd rather not go. I was ill or something.
And surely.
So I didn't work for 11 years, and then this job I got, found right eventually, got a job part time, but it's in retail. I would only go when the shop was closed. You know, go in doing refilling stock.
Wow.
Because the shop's shut, so, but then they try and get me like on different opportunities, you know, until, and I've been on once and I couldn't do it again. I had to walk off because you're constantly saying, you think you don't have to speak, I thought I'd just, but people do talk to you, and so then you're like, to a customer, and then I'm practising the mirror saying, would you like a receipt, you know, so I don't look like.
Wow. Okay.
And you can't. And then I think, no, they can tell, and they're all. And then if you see somebody like, you know, and every customer, you're looking at them thinking, Well, they're not ill. Their face is normal. You know, they're confident. People that weren't confident when I knew younger were now in like full lives with their husbands and the children and normal. Whereas I feel like just like surviving, like really.
And that was constantly in your mind?
All the time, still is, yeah.
See, I've considered this definitely a physical disability, but it also destroys people emotionally. It slowly chips away.
Yeah, that's what it is, bit by bit. So it's
Yeah.
more profound, really, in a way. Whereas a big thing, one thing you can, it's daily.
We had someone earlier this year, and I just found the whole thing so funny. This person came in here complaining about the fact that the artificial gum colour,
Gum colour.
something you couldn't even see until you pull your lip out the way
I didn't
and
know
have
there
a
was
look,
a
right?
thing even.
Which they were staring at, by the way, in the bathroom. And when they pulled their lip, it threw a shadow onto the teeth. So I had to prove it by illuminating it properly and taking a photograph, right? Oh, but they were complaining about the gum colour. So I normally never get involved. I leave it to the clinicians. But my clinicians went, this person is just not understanding. So I walked in and I just put the start picture up,
Yeah.
which was 5 teeth. 3 in the top, 2 in the bottom. Couldn't chew a thing for love nor money. Dentures hadn't gone in the mouth for 11 years. This person had never left the house.
They're complaining about gum. Well,
And I just said, okay, whatever it is that's bothering you, it's totally irrational.
yeah. So there's something else going on there.
Okay,
Yeah.
so whatever it is that's going on, in my view, has nothing to do with us.
Definitely.
And we have to stop this now. And I'm going to remind... You walked around with 5 teeth, and we've got it all documented for 11 years. 8 weeks later, you've got 24 teeth.
Can eat what you want, more or less.
A near perfect alignment to your face. Near perfect.
Yeah.
Because your face is asymmetric. So if I put something symmetrical in the middle of your face, when your face is asymmetric, everyone's going to be staring at your
I
teeth.
don't think about
We
that,
don't.
yeah.
Yeah, exactly.
Yeah.
This is how many layers of complexity there are for every single person we treat. And I'm sorry, what is really making this unfair is in the time that my colleague is arguing with you and you are arguing with him about the colour of your gum,
Sorry, I shouldn't laugh, but
there's another human being who would beg to be where
Definitely.
you're at
Oh,
right
yeah.
now.
Exactly.
And we should be helping them.
yeah, there's something else going on, like you said, there has to be.
Take it up with your therapist.
yeah.
We just want to help other people like you. You understand? This isn't all about you. You are one of millions.
Exactly.
Okay? Whatever it is, it's ironic to me that people just don't understand the sheer scale
Well, yeah.
of the need.
Well, I was shocked. More, I've gone when I first started about it and hoped and like you say, anxiety and scared, and then not worth it. I'm not worthy of it. You think
Not worthy of it. Where did you get that thought from?
because like you say, it chips in every day. I think. I mean, I've had stupid things like only because I got a letter today. They do gas safety checks on your gas thing. You know, when you rent a house or anything.
Yeah.
And I've had court charges because I won't let them in. Because I won't answer the door because they have to speak to them. So I've had to ring. You know, daft things like, I think, why did I not? You know,
So you won't answer the door to the gas safety check guy.
No, because
just in case you have
he
to
won't
speak to
talk
them.
to me and he won't ask me
I
things. So
mean-
you're like, you know, or I'll say, I'll just sit here while you go upstairs, you know, like that.
The disability, this
It is a
disability.
yeah,
it is a
it is.
disability. It upsets me that it's not included in the Disability Discrimination Act. It upsets me
Yeah,
that
in a way.
the powers that be seem to think that everything else is a disability, not this.
Yeah, I think it's all
I'm
about...
like, what the hell? Okay, well...
Well,
you
I
know,
would never have thought that.
But if you
Well,
think about
be
it
honest,
today,
no, well,
what,
yeah.
if you were missing your arms, you'd be disabled. Why is it different if you're missing your
it's not
teeth?
because they're like, the change, the effect it does have on you mentally, yeah.
Of course it does.
Definitely.
And
Without
this is
that.
the bit that I want the conversation to be more open about. I don't want this being a social taboo. It's not a social taboo if you're in a wheelchair.
Yeah.
You don't vilify people. You don't laugh at them
And you
behind
say,
their
have you
back
done
because they're
that?
in
They
a
don't
wheelchair.
lie. Nobody knows even. Nobody at work,
you
I don't
shouldn't
think.
have to live like that.
They know, like my boss said, I can't go on tour because I had a bridge. I said, I've got a bridge on, but I'll make anything up but the word dentures, you know what I mean?
You shouldn't have to live like that.
No.
It's a basic human right to feel complete, in my view. Medicine isn't perfect, but we can help a hell of a lot more than we could, and we're going to be able to help even more in the future. And I'm just never going to stop until I stop.
Except that word hope. When I just got an inkling, we started looking at, following on things and thinking, I didn't know if it was possible, but the hope.
Hope.
That word.
It's so
I never
important
thought
to
it
all of
was.
us.
That was it for me before, in my head.
I don't want anyone to feel that way, ever.
And then somebody said about bone grafts, but they won't now at your age, and they won't.
They won't at your age. What the hell does that mean? I remember one particular, I want to end with this one, right? This is one particular case I remember. 2007. A lady came to see me who had had dentures since she was 11 years old. She was now 61.
11.
All her adult teeth out at the age of 11. Imagine that.
Can't. God.
Imagine a teenage girl going through her teenage years with dentures. Imagine school. Imagine what happened to her.
Oh, that's terrible.
She came in 61 years old. She'd
So
never
50 years
married,
she's had dentures.
never married, took care of her mum right till the end. The mum said, I want you to use my inheritance to get your teeth sorted out.
Oh.
And the mum had been going on about it for years and years and years and years. And she kept making excuses saying, so the mum offered her the money. And she said, Mum, I'm not spending the money on me. I want to take care of you. And as a mum, the mum wants child to be happy.
Of course, yeah.
So she comes to see me in 2007. The mum had insisted. So it was a mum's dying wish. So she felt obligated to do it. And she said it to me. She said, I don't really want to be here, but it's my mum's dying wish. Okay, fine. I looked. 61 years of denture wear. There was no jawbone left here. There was about 6 millimeters, just over half a centimeter. The risk of breaking the jaw here was sky high. But then she said something to me. She said, I always do what my mum says. You have to help me. She said the magic word. She said, you have to help me. I couldn't.
Oh. You couldn't help her?
I couldn't. Because we had no techniques to deal with that.
The long term of dentures,
Bone grafting was too unpredictable. One of the alternatives was zygomatic implants, which go into the cheekbones, but they would have ended up in the middle of her palate, and it would have been so bulky that it would have been a hygienic nightmare.
Right.
It would have probably fallen to bits within 5 or 10 years. I'm not doing that kind of stuff. And the block grafting from the hip and all that to her at 61 years of age with her medical condition. So I said, look, right now, the answer is no. But I'm going to think about it, and I'll get back to you. Never left. That was 2007. 2009, I phoned her up, and I said, I found a way. She was literally back the next day. I had it on the big screen. I just drew then. I didn't have
you'd got it. You was determined in your head from that assessment then.
I'm not delivering.
Did she not keep ringing you up about it? You just
No. I said, leave it with me. I'll get back to you. She didn't keep ringing me about it. She must have thought I'd just forgotten about it. I didn't. It stayed in me because I hate that. I'm the kind of guy who just needs to work something out, can't let it go. And I said, listen, no one has ever done that before. It's safe. I've run the calculations. I think it'll work really well. We have to do things exactly like I say.
Yeah.
And I'm going to tell you now, after wearing dentures for 50 years, when all that plastic vanishes, you're going to have to learn how to talk again.
Yeah.
And that's going to be difficult. That's going to be the hardest part of this, is readaptation and muscle support. So you're so used to not moving your lips, you're going to have to, girl.
Yeah, especially from 11, gosh.
Right. And I said, you have to be mentally prepared for this journey. So anyway, we did the surgery. Worked beautifully. That was in 2009.
Yeah.
So I reviewed 2010, 2011, 2012, 2013, annual maintenance, seeing every year. Everything's perfect. She came in one annual maintenance and she just cried. I said, why are you crying? And she said, I wish my mum was alive.
Yeah, she died.
And people ask me
why you do it.
Why I do this job.
She wouldn't have known her. You know, you say getting you back, she wouldn't have known who she really was, would she really?
Never.
Like you said, no.
Never.
Teenage years were like that, and no, never marrying because of it, probably. So no children because of it. Oh,
nothing.
It's a disability like that.
It's a life. It's a person. It's a real human.
Yeah.
And you can't undo
things like
the
that
lost
stick,
time.
don't they, with you?
You can't undo it.
And did she start living a different life?
Oh, my God. This woman, she's travelled to 60 countries.
Since she didn't know. Good for her.
60 countries she's travelled to. She's dating.
Wow.
Well, last time she was there, she might be married now. She's dating, something she'd never done her whole life. And, you know, she's living.
Alive.
She's alive.
It's amazing.
She's happy. She's like the rest of us.
Yeah.
She's going through the normal pattern of human emotion and existence.
Good.
Great. Mm-hmm. Thank you very much.
Thank you very much.
All got a bit emotional there at the end.
Well, that's different, Sandra. What's going on? Why don't you tell us all what's happened since we last spoke?
Well, since last spoke, I've had surgery for full
Top and bottom.
top and bottom
Fixed?
implants, yes.
No more dentures?
No.